And good
Good
morning.
morning, Public Safety Committee. I am here to present SB 6. You okay with me starting? Sure. All right. SB 6 will schedule xylazine as a controlled substance in California, preventing its illicit use while creating guardrails for the drug's continued use in veterinary medicine. Commonly referred to as tranq, or the zombie drug, xylazine is a potent veterinary sedative. It's intended for large animals, which you'll hear a little more about. But it is increasingly being trafficked in our country for human consumption. According to the DEA, xylazine-related deaths have more than tripled between 2020 and 2021, signaling a disturbing and upward deadly trend. Xylazine is often mixed with fentanyl to prolong the high, creating what has become the deadliest drug combination in the United States of America. SB 6 adds xylazine to California's list of Schedule 3 controlled substances, giving law enforcement the ability to restrict access and curb illicit distribution. Xylazine is not approved for human use. It is in fact called the zombie drug because it renders its user unable to stand upright and creates serious health complications, including dangerous wounds, which often lead to necessitating amputation. Unlike opioids, xylazine overdose can be reversed by Narcan. It cannot be, I'm sorry, let me restate that. Unlike opioids, xylazine overdoses cannot be reversed by Narcan, which makes them far more difficult to treat in an emergency situation. While the federal government has introduced legislation to address xylazine, there has been no movement on that legislation. California cannot afford to wait. It's crucial that we take steps to protect Californians from the negative impacts of xylazine. SB 6 ensures that California leads the way in regulating xylazine, protecting access for veterinarians, and preventing its misuse and trafficking in all of our communities. I have with me today, Mr. Chair, two witnesses. First is Dr. Grant Miller, who was speaking on behalf of the California Veterinary Medical Association, and the other is Ms. Moira Top, who's here on behalf of our sponsor, Mayor Todd Gloria from San Diego.
Thank you. Good morning. You have 2 minutes to present.
Thank you, Senator Arreguín and members of the Senate Public Safety Committee. As Senator Ashby mentioned, my name is Dr. Grant Miller. I'm the Regulatory Director at the California Veterinary Medical Association. Thank you very much for your thoughtful consideration of SB 6 today. Also, thank you, Senator Ashby and our staff, for bringing forth this very important public safety measure. The CVMA is in strong support of SB 6 because it makes aggressive moves to protect the public from xylazine diversion and abuse while balancing the need for veterinarians to maintain access to the important drug for use primarily in livestock, equine, and wildlife species. Xylazine commonly is used in veterinary medicine to provide sedation and pain control to livestock and horses. Its use and availability are of paramount importance to animal safety, human safety, and public safety by use with animal control officers who are using it to subdue loose and wild animals under the direction of a veterinarian. It's also used in zoo medicine to help care for exotic species. It easily ranks among the top 10 medications that are used by large animal doctors on a daily basis. I myself am an equine practitioner. I use it probably in about 75% of my cases to provide very quick and predictable pain control and sedation to horses. Usually within about 45 to 60 seconds of giving it intravenously, the horse is calm. I can then go forward and numb a wound that needs to be cleaned. I can stick a needle in an arthritic joint that needs to be injected with cortisone without being kicked. So I very much appreciate its predictable use in practice. I don't want to imagine what it would be like for my patients or myself or my colleagues if we didn't have this drug available. SB 6 will make California a leader in this issue by making xylazine a Schedule 3 controlled substance on our state controlled substance list, and will do so with language to help ensure that veterinarians will be able to maintain vital access to xylazine for its legitimate veterinary practices and procedures. Thank you for your consideration. We respectfully ask for your aye vote.